Hello, my name is Skylar Howell, fourth year urology resident at the University of Texas in Houston. Today I'll be sharing an overview of our upcoming work to be presented at the AUA 2025 national meeting entitled Glucagon-like peptide 1 receptor agonist use is associated with improved sperm counts in overweight and obese men. As obesity becomes more common, more and more people are taking GLP-1 medications like semaglutide, Ozempic, Wegovy, and tirzepatide, Mounjaro, Zepbound. Because obesity can lead to poor fertility, we wonder whether these drugs might have a therapeutic role. In fact, this has been demonstrated in obesity-related female factor infertility, but the data in men is less clear. Some non-randomized studies exist suggesting these drugs are, at best, associated with improvements in sperm count, and at worst, do not negatively affect semen. But there are also case reports of fertility issues associated with these drugs, as well as potentially negative effects on testosterone, which is crucial for good fertility. Our study tried to answer these questions using propensity score matching, a version of randomization, to assess whether exposure to these medications increases the chance of achieving normal semen count, motility, and volume in men with previously abnormal parameters. In a group with about 3,600 patients, we found three things. First and foremost, about 3% of the study group developed normal sperm counts, which was entirely attributable to GLP-1 exposure, given none of the control group did. We also see that these changes happen relatively quickly. The median follow-up period for these men exposed to GLP-1 medications was 337 days, or just under 1 year. This was much shorter than the median follow-up for control patients, 1,068 days, or just under 3 years. Second, some men experienced normalized motility, but this effect was not attributable to GLP-1 exposure, as the control groups also had a similar rate of normalizing. Finally, there was no volume normalization in the study group, even though some of the control group normalized. This may suggest an inhibitory effect of these medications, possibly via hormonal action, given the relationship between low testosterone and semen volume. However, the shorter follow-up for the study patients limits our ability to definitively reach this conclusion. While our study is the first in the literature both to specifically assess changes in semen parameters based on exposure to GLP-1 medications and to attempt randomization, there are several limitations related to the de-identified and retrospective nature of the work. For example, we do not know whether these men had clinical infertility, only that they had abnormal semen parameters. We also were unable to accurately report weight loss changes, a major limitation that underscores the need for further prospective studies with comprehensive hormonal profiling, controlled exposure data, individual semen analysis assessment, and inclusion of reproductive outcomes. Nevertheless, it may provide a starting point in counseling patients regarding fertility effects who may be starting these medications or seeking to improve their fertility. Thank you so much. See you at AUA.